Today's going to be really tactical from a just from an educational point of view of like what's going on, and really like overall movements didn't look too bad. Definitely saw some things that we're going to address. Obviously, that's why we're here. But ask questions as you go, take notes as you need. Um, I'll also upload this coaching call to the drive as well, so you can review it as needed. So you have that Google Drive in the messages that I sent you. So you may have looked at all the still photos. They'll make more sense as we go through. I just took those as kind of like, hey, these are talking points, right? And then good comparisons for when we do this later on. Cool. Going to be a heavy education piece here, so I expect us to take pretty much the whole time call wise. Um, but yeah, and then you have the reference for the photos as well if you need them. I'll be on the video drawing up some stuff. So, all right, so let me get this pulled up here. Share my screen. So if we look at the shoes here, right? Um, Looking at wear patterns, okay, it's a big piece of what I do. Um, so an ideal kind of walking pattern, which you may remember from the onboarding here, is we strike kind of outside of the heel, run down outside of the foot, we cross over and terminate at big toe, right? Yours is not too bad, but it's pretty typical of what I see people that deal with either plantar fasciitis, Achilles tendinitis, or some form of midfoot pain here, right? And the reason that's the case is is kind of interesting, and it's really just based on the again, the wear pattern that's happening primarily in the middle of the foot, right here, right? So when we have this wear pattern where we're really, really heavy, it tells me that we're here and we're basically terminating at this point because you can see a lot more wear towards middle of the foot than we do towards big toe. Does that make sense?
Yeah, totally.
Yeah. So again, that's one of those where we need to adjust how well we are actually getting to the big toe and engaging it. And that comes through, especially on this right side, in pretty much all of your movements. So that's going to be a common theme is how do we improve pressure here? Because this should be a transition point, right? But for
Okay.
you, we're kind of living in this alley here,
Yes.
right? And that again could be the cause or the compensation, which is also kind of pushing this Achilles stuff along consistently. Because especially when you run, we're in a significant amount of pronation because most people are kind of forefoot to midfoot strikers when running. But if we don't have the stability through the middle of the foot and we're only shoving pressure here, right? That becomes a problem with how much the Achilles has to do, right? Because it
Yeah.
means we're not really loading through the foot effectively. We're actually in a big compensation pattern, right? And I'll talk about what that looks like, especially as we get into your movements. But the shoe kind of told me a ton here. Tells a big story of like your day to day, right? Um,
Those are old shoes that are like retired. I sent the newer ones that I'm running in, but
mhm,
they weren't as worn. Um, so I,
yeah,
I couldn't tell as much, but the color differentiation too. I guess you can still kind of see some like in the foot there. Um,
for sure. Yeah, I
but
would
yeah,
say like your striking here is fine. Like if these are running shoes, I don't expect a huge heel, you know, wear.
yeah,
Obviously we don't strike on the heels heavy like we do with walking. However, we're still very, very heavy in this alley here.
Yeah.
right?
Yeah.
Um, and even with running, like, yeah, we're going to be more, again, probably midfoot and forefoot pressures primarily. um, but if we're not loading through midfoot as well, this leads to a ton of issues up chain,
Yeah.
right? And I think that's where you're getting this recurring issue is like kind of the resting from training, the going into training, then it starts to kick back up and kind of that yo-yoing effect, right?
Yeah.
It's this isn't this isn't changing and it's not really allowing the Achilles to heal. And even with rest, as the Achilles heals, that's kind of a double on time. Anyway, um,
Yeah.
as it continues to heal, right, it's not actually changing. The mechanics haven't changed, and the stress goes right back onto that primarily.
Right.
And then that's where you run into issues with that, the flare up pattern. So shoes total lot, which is good. Like that's why I do it. Super helpful.
Yeah.
Um, and then, as we get into the movements here, um, like I said, you can reference the pictures if you want. I'm going to be drawing everything up here, so you see what I see. Cool.
Yeah. Sounds good.
Okay. So there was a lot of good things in these movement patterns too. Like I don't think there's as much to tweak, which is good. But we do have some deficits here that we need to address, right? So off the bat, right? And this could have been your first squat where it's like we had to find that hip position, right? So we go from like straight toes or kind of flared, we have to flare more. The flare is not something I'm worried about, right? Everybody's going to flare toes, mostly everybody. What that does effectively is opens up the hip here, puts it into more external rotation, which allows you to get deeper into the squat. Not inherently bad. That's most people do it.
Yep.
However, we have to understand what's now happening as we get to depth. So if we watch it live, like there's a lot of instability happening here. And it's stemming from what's not really happening at the feet. There's a little bit of hinge mechanics that we're going to clean up to help with this, but we're a little wiggly through right leg or left leg, excuse me, and then definitely wiggly and more externally rotated through your right leg, right? And that is primarily, right, we're externally rotated more here because we're trying to make up for what's not happening here and at the foot, right? So we open up hip more to make up for lack of range at the ankle and primarily, in your case, at the foot. So as we get deeper here, let's clear everything. So as we get deeper here, right, I'm looking a lot at what's happening there and there at the foot,
Yeah.
right? We're staying kind of rotated out at the tibia, and we're in a more supinated position here at the foot, right? That arch is coming up, whereas you see on this left side, like that arch is coming down pretty well. But we're definitely arched up a little bit more here, right? It's very subtle.
Yeah. It is. It is. Yeah. My overhead mobility is so bad. I actually think that these probably would look a little cleaner had I not had my hands over my head,
Yeah,
to be honest. Um,
exactly. Which is why I do
yeah.
this motion.
Yeah. I was gonna say, I was like, oh man, that really changed. Like, I don't know, it it changed it a little bit for me. And I was like, I wondered if that was part of why.
Yeah,
Um,
that's why
because
I
I'm
do it because it basically forces you to not compensate with your back.
Yeah.
And if you do compensate with your back, it's very, very noticeable. And I'll show
Yeah.
you what that
Okay.
looks like in the profile view, because that's a note that I made was like it exposes some deficits there that we need to work on some thoracic stuff too, right?
Yeah.
But a lot of it stems from here, right? But those are two areas where it's like, for me, low hanging fruit, thoracic mobility, right? For most people, even if they're not dealing with a shoulder issue, upper body issue, but like for low back stuff, for even some knee stuff like that thoracics. I mean, we add in a little bit of thoracic stuff here in the next few weeks, like it's probably going to feel pretty good. My main concern that I want to address specifically is the foot stuff, right? But thoracic is going to come into play here.
Um, One other thing too, that I've noticed, just kind of over the some fighting. When I first when it first happened, and I thought I like the scratch and was just like, oh, what's going on? I really noticed that I don't know if this is old like ball injuries was or just ankle injuries. My right side specifically, I can't force into as much dorsiflexion as I can get on my left. Like if we were in person and you like got up close and either forced it yourself or just like, went really zoomed in. I don't know if it's hard to see on video or not, but like my right ankle does not get the same degree of subflexion that I can get on the quadriceps. I I don't know if you're just seeing if you can automatically see it pattern. But that's just something I just try to understand. I
Absolutely.
I just don't have.
Yeah, and there's a reason why here, and it's not so much ankle, right? It's more so what is not happening at the foot. You got a couple things not happening at the foot, which is we're not getting enough pronation here, and part of that is we're not getting this transverse arch, the proximal transverse arch, which is commonly overlooked um, with your typical foot rehab. But it's right in here. If we think of like cuboid and the three cuneiforms in the foot, right? If stop share real quick. So if we're looking at foot here, try to take the shine down a little bit, see if we can help. So cuboid, right? Big bone here. Then you have your three cuneiforms, right? And naviculars here. So cuboid, three cuneiforms. There's a transverse arch right along here, right? You have a proximal one and you have a distal one. Both are considered the transverse arch of the foot, right? When we go into dorsiflexion, right, shin dropping over, what has to happen is those bones here need to actually kind of spread, kind of like this, right? So that means that bony part of the top of your foot needs to be able to get like lower. In your case, it's pretty easy to see compared to the left that it's not doing that, right? Which means you're not able to get to true pronation. Even if we were to shove you to the inside of your foot, right, and hit that medial arch, like that's not like true pronation, right? Because you'd still be stuck, caved up, right? And we're just shoving it inside. So that's going to be extremely important with this kind of these first couple weeks, like some of this mobility stuff is your foot's going to want to lock into this supinated position, especially at this joint. Whereas we want to allow this part of the foot to kind of spread, right? That way it can get closer to the floor. It creates more length through the plantar fascia, allows you to better load in the middle of the foot. Again, so we can build strength with that and then take off pressure from the Achilles, right? So that's kind of the big key here. And that's why this initial phase is very important because if we don't get this, the rest is not going to be as effective, right? It'll help a little bit still, but if we don't master that, this this approach is just not going to be as effective. So with the pronation supination drill, which I'm going to run through with you because that's going to be really the biggest one early here that we need to focus on. Um, in that, right, we're going to focus on not gripping toes and focusing on allowing length through the middle of the foot, which is easier said than done, that you'll find. But especially with your right foot, like that part of your foot's just not getting to the floor, right? Which means we're not getting into true pronation. And then if we take that back or take it into running, right? Where you are midfoot striking, mid to forefoot in your case, it looks like. Um, and you're not able to get access to that transverse arch. And if you are, you're kind of just slamming into it, which is making things unhappy and causing that Achilles to want to like yank and pull and take all the stress, right? So again, early on, gaining access to that true pronation so we can load in it. So that way when you run, you can load in it appropriately. Your foot can be a foot, and your Achilles can be an Achilles, right? Um, that's the key here, right? So if we solve nothing else, I mean, everything else matters, right? We got to make sure hips are in check, got to make sure the tibia is doing what it's doing, but that's something that has to happen. So that's our focus early. Okay. Um, and I'll run through kind of how we're going to address that specifically. Cool. Um, but yeah, that's again, the biggest thing early that I saw that was present with each and every movement you did, right? There's some aspects of instability that we're going to need to address with the foot once we gain access to that motion. But again, we got to get access first in order to actually load within it, right? Um, we're going to look at the hips, make sure the hips, we're getting good internal rotation of the hips so you have a better downward force, especially when you work out and when you run. Because if we don't have that internal rotation at the hip, we lack some downward force towards the ground. Again, throws off the load a little bit. So we want to make sure that's cleaned up as well. But the foot is a huge part of that too, right?
Sense.
Um, any questions about that?
No, that makes sense. I mean, especially if it's not getting into nation and allowing me to float in kind of that big toe area, that or kind of wear pattern shoot like that actually makes sense.
Yeah,
Yeah,
yeah.
it's unloading.
It's a lot to digest, right? There's a
Yeah,
lot of stuff going on.
yeah,
But to keep it as simple as possible, like we need to be able to load through the middle of the foot. That's the message, right? The way we're gonna do that, like you don't have to think about it too much of like what to do because that's what I'm here for. So it's just paying attention to the cues, being mindful of what you're feeling during those to make sure that we're getting load through the right areas, right? Uh, that's what you got to pay attention to as you're going through and give feedback, and then I'll see videos to give you feedback as well. Um, but yeah, it's easy for me to see in this video, like it's pretty clear. Once we are here, we can see this is not getting, it's a terrible circle. So this is not coming down to the floor. This transverse arch. This one is a little bit, and you can see the tendon popping up here, which is your anterior tib that's literally pulling you into supination, right? Right where that anterior tib attaches, and the goal of the anterior tib is literally to dorsiflex you, right? But it's active dorsiflexion when it comes to closed chain dorsiflexion like this in a squat. This, like, we don't need that anterior tib to do the work, right? We have gravity. We need to be able to get into passive or closed chain dorsiflexion, which doesn't really take a lot at the anterior tib. It takes more at the foot and the tibia itself to be able to internally rotate here, go down at the transverse arch, and get to this medial arch. That's dorsiflexion, right? That'll help drop the shin over the foot, which is true dorsiflexion. Does that make
I
sense?
was say, yeah, that tip band popping up is definitely.
Yeah. Yeah, I mean, you can see side to side, that's pretty clear, right?
Yeah.
Um, but yeah. So that's something we're gonna fix.
Yeah.
Okay. And then also like another little note here, tracking of the knee, like we're tracking pretty close to like third, fourth toe. This knee we're tracking a little better towards kind of big toe, little toe, or big toe, second toe, which is where we want to be from a knee tracking standpoint. That tells me the tibia is rotating in. We're getting some internal rotation here at the hip to allow that knee to track better. Make sense so far?
Yeah, definitely. Definitely.
Okay.
That's it's funny too. I noticed too I have good external rotation of the hips and my internal sucks.
Yeah.
Um
Same.
yeah, yeah,
Same.
yeah.
Same.
Yeah,
It's a every time I do any sort of leg day, like I'm hammering internal just to help me out. And it's been super helpful.
yeah,
I've had some like, I've had knee issues in the past, I've had ankle issues in the past. I've had issues pronating and just driving my foot to the floor. And that's been a big driver of my injuries. So I'm definitely with you there. All right, profile view here. So really like depth of squat, not bad. But in this specifically, let's look at like upper back and low back. So we're good, we're good, we're good. And then we kind of dump.
right there.
We start to dump forward, right? And we have a little bit of that butt wink, which isn't inherently bad,
Yep,
right? However, we're not even loaded right now,
right.
right? And the reason why this is happening is because we're not dorsiflexing here. It's not a hip problem, right? We do need to access better internal rotation at the hips, but this is not a hip problem. This is a foot and ankle problem, right? Now, again, low-hanging fruit, we can definitely improve some, upper back mobility. Not bad because we have a lot of lordosis here, right?
Yeah,
So we're kind of shoving everything into the low back because we're missing a little bit here. But again, the big thing here is not like this isn't a terrible position of the back. And even with that little bit of a butt wink, not terrible, but we're also not loaded. And that's what we need to be cautious of. Like, hey, if we throw a bar on your back with, 185 pounds, then how's this going to look? Right? Honestly, probably not going to feel great if I were to guess. If you were to get to this depth, right? Sometimes our body stops us from getting to the depth because we feel unstable, right? And that's where people just don't get down as far in the squat because they don't have stability once they get to this depth. But in your case, it's like we need to clean Feet up, ankles up, hips are going to be part of it, right? Because we want them to work together. Obviously, that's the point. Um, but biggest low hanging fruit is right here, right? And that's going to be the point of emphasis from a mobility standpoint. Make sense?
Yeah, definitely.
Something else to notice here, and what kind of hammers home the point of that transverse arch conversation we had
Yeah,
is pressures of the pinky toe here, right? So we're kind of lifted on the outside here, not as much pressure. And then we definitely aren't getting as much pressure on big toe, which keeps you teetering through middle of the foot, which makes you feel like you need to stiffen up that mid-tarsal joint or that transverse arch, causing you to kind of, again, teeter in the middle of that foot, which is where a lot of your wear patterns are. Does that make
whereas
sense?
I need it to pronate through to put pressure over that big toe.
Yeah. And if you
Yeah,
go back to like the onboarding video with the tripod foot, like we want to be
yeah,
planted through pinky, planted through the toes, right? And then
yeah.
we have planted through heel. That's our tripod, right? That creates stability as we're loaded, right? Then from here, with those 3 points engaged, being able to pronate, drop that transverse arch, create length through the bottom of the foot so we can load through it while staying stable on these 3 points. That's like the goal. If it's foot mechanics in a nutshell, that's probably it, right? Now, easier said than done, don't get me wrong.
Yeah,
Um, but the good news is like there are drills that we're just going to hammer home that are going to clean this up if you work at it, right? And I don't have
yeah.
a doubt that you will, but it's one of those like some people take those drills for granted because they don't feel hard, but taxing is not the point, right? The intent of the movement is the point. And we can see here, going on kind of the lack of pronation on this right side, I like to look at what's happening at the heel. So tibia, heel, right? So that's actually subtalar eversion of the heel, which is normal with pronation at the foot. We're pretty much a straight line here, right? We don't want a full collapse, right? We don't want a full collapse here. But this just tells me your rear foot, which your Achilles is doing this, or is trying to help prevent this. This part of the foot's not moving, which again limits how much the midfoot can do. Because the subtalar joint only does eversion and inversion, does a little bit of dorsiflexion, plantar flexion, which is important. But the subtalar joint specifically helps with transferring load from outside of the heel to inside of the heel, which also allows the midfoot and forefoot to do the same thing as we walk, right? So this joint, again, is another one that's commonly missed that we're going to hit early because we need to get that moving again, right? It just reinforces the stiffness within the midfoot, right?
That especially that view that is so
Yeah, I mean, it's pretty clear, right? Pretty cut
yeah,
and dry. Because really the rest doesn't look bad through here. Like we see that little bit of knee flare on the right, but really hip position relatively level, right? You might be slanting down a little bit here. I'd say minimal at most. Um, so again, hip level, again, this is not a hip problem. There is some internal rotation we need to fix, we need to address here.
yeah.
But I think you'll be able to access that better if we fix what's happening at the foot and ankle.
round up and it'll all play together.
Yeah. Yeah. But yeah, so that was a pretty telling photo here just from the subtalar joint piece, right? So you can see the pressure, how we're kind of lifted on the outside a little bit, more heavy on the inside, but we're dead center right here, right? And then this one is just about the same thing, but another point to note is basically the pressure at the pinky toe is not as much. Same thing at big toe. We're kind of teetering a little bit here too, which forces these toes to grip, which makes it harder to pronate, right? And I know left side's not a major, like right side is the problem here, but like this stuff is still happening on both sides. So we're gonna hit both sides anyway.
Yeah,
Cool.
yeah, makes sense.
Lunge wise, not bad. Like no nothing crazy, but I think we see here that little flare at the knee.
Yeah,
So if I rewind, we step, and then automatically flares out. We kind of come in, but really when you start to bend this knee, you're forcing this tibia not to internally rotate, right? It's immediately coming out this way. Whereas when we get to depth, and you do eventually get there, kind of,
yeah,
right? Honestly, like, but you don't do anything different at the foot. I think you just shift your hip over, right? Because if we go from here to here, the foot doesn't change. So I wouldn't even consider that the tibia really rotating like at all, right? So we're the knee's tracking towards like pinky toe at this point. And then we shove it back in a little bit. That's probably about third toe before we come out. Again, this is not a hip or knee problem. It's a we're not accessing the middle of the foot at all, right? So again, this is the common theme, the common pattern. I'm just showing you in different pieces here what this looks like. So a double leg version, this would be like a single leg biased version, right? And then pinky toe lifts, we're really heavy through midfoot again. Here a little bit better, right? Not near that wiggle,
yeah,
right? And you actually do get to some pronation there, and that transverse arch drops a little bit. And then dorsiflexion, right? So not like honestly not terrible. Not terrible.
yeah,
It's just
yeah.
we want more,
Sure, right.
right? We 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 need more here, right? If we think of that's 90 degrees, that might be a generous 90 degrees.
Yeah,
Um, if we're talking about this angle here, I'd say at this point maybe 15, 20 degrees, maybe, give or take. We like to be closer to about 30 in the closed chain, especially if you're going to be running,
yeah,
right? But also for squatting and lunging, right? Like we need to, like this, yeah, not terrible, but it is if we're just shoving everything into the knee and into the ankle with the foot not being a foot. That's why I don't
right.
think it's a pure ankle issue. Most people, most therapists as well, think, oh, we just got to do a bunch of ankle mobility. It's like, well, maybe, but probably not. Unless you're post-op, like post-op Achilles rupture, like, yeah, you got to eventually create length through the Achilles, but you want it to be stiff. because that's what creates power under tension, right? It's just people feel stiff and jammed up in the front here because they're not accessing their foot and their transverse arch is not dropping. Transverse arch doesn't drop, you're going to be shoving right into that, the navicular, the cuneiforms, and the cuboid. Makes sense so far?
Yeah, yeah, no, it definitely is.
In here, this one we can see the midfoot on this left side a little bit better. We can
Yeah,
see really well how you plant, and honestly, like the load is better on this left foot. Like we see that length be created from there to there, right? So you see higher arch, we load midfoot better, lower arch, and we see how much more dorsiflexion you have, right? And that is a lot better compared to what on the right side you're about here. And that may not seem big for dorsiflexion. That's huge,
I was gonna say that's significant.
right? And you even said you feel it, right? That you can feel
I,
the difference.
I
um,
so
but you can see how much better we're loading through here, right? There's still some stuff we can clean up on the left side, but not near as egregious as the right. So that was a good view of like, hey, here's what like we should be aiming for, especially early. So, all right. I know there's a lot of information.
yeah, no, no, it's great. I'm tracking with you.
Do what?
I said I'm tracking along with you.
Cool. It
Yeah,
helps that you do have the medical background too. I will say
yeah,
that.
yes, no, you can talk the talk. Yeah, I don't think I told you this. I was actually a second degree nurse. My first degree was exercise science. No,
Oh yeah,
but I
nice,
thought I wanted to do PT school on a shot at orthopedic surgery and felt
nice.
kind of changed my trajectory. So
Well, career-wise, probably not a bad move, given
yeah,
the debt to income ratio and the state of healthcare. Uh,
that I've had a few people tell me that. And yeah, I that was cool.
yeah.
So, yeah, no, I just worked as a bedside nurse and
Hmm.
back from my master's during didn't occur the same. Yeah,
Yeah.
yeah. I love all the PTs that I've worked with in the hospital and on the floor. But it's just like, gosh, you guys are so much smarter than what and better educated than what you actually get functionally get to do. Um,
Yeah. I
in
would
our
agree.
yeah, in our current healthcare system, just this the setup and what it functionally ends up being. So yeah, anyway, that's a much bigger distinction, I'm sure.
For sure.
Have
Yeah,
pretty
we
similar
could
views.
we could talk about that all day long.
Yeah,
Um,
yeah.
but it's one of those like and the bad part is it's the PT's professions like we're at fault for it as a profession. An APTA is a freaking disaster, but again, another
Yeah,
conversation for a different time maybe. But all
yeah,
right, so
yeah.
back to movements here. RDL, not a ton to talk about. We're a little grippy through the toes here, middle of the foot. This just shows, okay, we need better pressure through those 3 points. That's the main takeaway here, right? You can see the whites of the toes here, which means we're just grabbing and gripping for dear life. And that's an exaggeration, but lot of grip there. Even on the left side here, right? Same thing, pretty grippy through the toes. Again, we're going to try to reduce that because that just creates more tension and on the bottom of the foot and doesn't allow as much pronation. Again, the drill will take care of that. Now, from the back here, I want to focus on this is going to be another gigantic piece is hinging, right? Getting you to hinge better, right? Your hinge wasn't awful by any means, but the hinges usually poorly coached and usually um, just hard to pick up, mainly because people don't know what an actual hinge is or what it's supposed to do. It's supposed to create tension through the glute here, right? Now, another thing that many people miss when this is coached is we don't know, like people don't know how the actual glute max is oriented, and it's not straight up and down like the hamstrings, right? If it were, this would be perfectly fine. However, the fibers run this way for glute max, right? Because they attach to the lateral part of the femur, right? So they run more medial to lateral. They don't run superior to inferior. So what that means and why it matters here is we see this dip in the hip here, right? What that effectively does is shorten these fibers, which means they're not getting length, which means they're not creating more tension. The point of a hinge, an RDL, a deadlift, whatever, is to create tension through the glutes so that we can use them to pull back up without using as much back and to help out the hamstrings, right? Hamstrings are a secondary hip extensor. The primary hip extensor is the glute max, right? So to clean up the hinging patterns and to help you create length through the glutes specifically to give the Achilles, the hamstring, and the back some help, I have that in your program with a lot of cues and a lot of stuff going on, another kind of like high intent exercise to help improve that,
Yeah.
right? Because it like really, if I were to look at this 2, 3 years ago, I'd be like, yeah, it's pretty good. Nice depth, right? But now it's like we're essentially taking slack off this glute. You may feel a little stretch here at most, I would guess, right? So a lot of the hip rotation, that pelvic rotation, right? And then also from here, like this is now a back movement, right? And we haven't even started hinging, and we're already really rounded through this back. So in the video, you're gonna see and hear me cue like, don't dump forward, right? We need to not stay like completely erect, but we need to keep some form of a neutral spine here because what happens is when we dump forward, we actually rotate the pelvis back, which will effectively take tension off the glute again, right? Now, you will still get tension on the hamstring here, which is fine. This helps hamstrings. It's good for hamstrings. But we need to also be able to create tension through the glute. So this is where like, the whole sleepy glute syndrome and this and that doesn't exist. That's just that's nonsense that PT's made up. It's stupid. um, like the glutes are still active. The glutes are still strong. It's the strongest muscle we have in the body. However, some people just don't access them as well because they don't know how to create tension in them. So it's like it's not that they're weak. It's just that, hey, we need to just create more length so that we can actually use them better. It's not sleepy butt syndrome. You don't need to do 1,000 bridges, you know? It's not, I don't know what they called it, sitting butt or I don't know, some stupid like that. But basically, we dump everything into the back, allow the hamstrings to create the tension. We get no opening here with that glute. So what I'll teach you in that video is exactly how to do that. And that's a honestly, when it comes to lifting, game changer. Right? People go from like, yeah, I just feel all my deadlifts and good mornings and RDLs in my back. We do this and like, okay, I feel nothing in my back. Good. Right? Because you should be feeling it here. The back is going to be stabilizing. It shouldn't be doing the whole job. And again, that's a common missed thing in rehab. And it was the same thing on left side. Like really foot and ankle wise, you're still pretty well turned out on this right foot. We're not getting pronation. All that is still the same. Here's just a good view of how are we hinging? What do the hips and back look like here? And then video here, like heel raise didn't look bad. We're still heavy, heavy, heavy in the middle of the foot, right? All the pressure is right here. When we do our heel raise, like I want a lot of your pressure to be through big toe, okay? And then we want to create, like you're getting into supination here, which is what we want, but you don't have a problem getting into supination,
Right.
right? So that's not what I'm worried about. I am worried about the pressure is in the middle of the foot and we're in supination, whereas I'd rather have it further onto the big toe. And in the videos, like when we get to that stage of heel raise, that'll make more sense. Because this needs to be a place of stability. If we're teetering in the middle of the foot, it's tough to be stable in that situation without big toe being as engaged. And then like good supination there. Like we see that we have this heel that's inverting, which is what we want. That's supination, right? Again, I'd like the pressure to be a little bit better through big toe, but overall not bad, right? You can see there's a little bit more space here under this part of the foot compared to here and compared to the other side. So like that foot definitely looked better from a pressure standpoint, as we can see better pressure on this part of the big toe, a little less pressure on the outside. Cool. All right. I know we're kind of running close on time here, but a lot of good stuff. So walking. Okay. Really, you're walking, it's going to be this, it's going to be basically the same messages here. Um, and I'm going to actually, because I took some pictures here. Make sure I have my notes down. Most of yours was what's happening when we're in kind of the stance phase here. When we talk about pronation, right? When we talk about gait in general, we hit the heel, supination.
Yep.
We load the foot, pronation happens. You do get some of that through your heel here. You don't get any of it through the middle of your foot, right? You see how this is still kind of locked into supination,
Yeah.
right? So we can see that bone popping up still.
Yep.
We can see this arch is still present. Pressure's off the big toe, right? Because this is the point of loading midfoot, right? In your stance, right? Feet are about even with each other. All the weight is straight down over your foot, and yet we are still shoved into supination, right? And it doesn't change a whole lot, if at all, from here to here. You basically go supination, supination, supination without ever really getting true pronation through the foot. And since you don't get true pronation through the foot, all your pressure is shoved into the middle of your foot here. We don't actually get all the way to the big toe. So when you go back to the wear patterns of the shoe, where everything was stuck in the middle and we were terminating kind of at toes 2, 3, 4, rather than toes 1, 2, that's what's making you live through the middle of your foot and forcing your Achilles to do more for thousands of steps a day, multiple thousands of steps a day, right? This is where like I said, you strike fine on the heel. We get to middle of the heel, but we never really get to inside of the heel. And that's where this subtalar joint's not allowing you to rock through the foot. It's keeping you closed down. Whereas you see here, right, kind of in that mid stance, you're already on the inside of your heel. Right? You see the dark marks here, right? That's the shadow, how you're lifted, and the pressure is right here in the heel. Whereas if we back it up, same point in the gait cycle,
Yeah.
even a little bit further, right? We are still really living through this part of the foot. Make sense?
Yeah.
Okay.
Yeah.
So I know all this is the same message over and over, but it's, I think, helpful from like a, okay, it's not just when I'm in one position. It's not just when I'm walking, not just when I'm running, not just here or there. It's like this is a ongoing theme. Rotation here looked fine, no major notes. Um, didn't look too bad. Maybe a tad stiffer going to the right, but past that, no problems. I just screen that. Every once in a while, I find something in that, and it's like that makes sense. Okay, that was a lot. That was a lot. I understand. We are almost done here. Um, so three main things. Not a big stretch person, but this is one that's going to help that tibia. Okay. So it's getting you into dorsiflexion, forcing you to internally rotate that tibia. You're not going to actually feel that happen. Um, like I'll go through a bunch here. So like you see me twisting down, and what I'm cueing here is getting that pressure through the middle of the foot. The tibia needs to rotate to help create pronation at the foot. So when you're doing this, try not to grip the hell out of your toes. If you do that, it's going to keep you into supination, right? We want to promote pronation, proper knee tracking over foot, first toe and second toe. 90-90 hip internal rotation. This is a this is a tougher one,
Okay.
right? So I'm basically putting you into end range, and you are
Yep.
lifting that back leg.
Yep.
It is hard, right? But it's a good one, right? You'll get a good stretch on this front leg. This is going to be tougher on the back leg, okay?
Yep.
This is key, okay? This drill here, it's a longer video, almost 5 minutes, but this is teaching the knee to bend, teaching the shin to go over the toes, teaching you to pronate and supinate appropriately, okay? So I try to go into a lot of details here, a lot of different angles. So again, trying to create length. I have taller arches, so I think it's a tad easier to see on this, but you can see how the foot is dropping down here, right? That's the point, is getting this shin to drop over the toe, right? By leading with your knee. And the video goes into so much detail. That one you could probably do for the rest of your life and still find stuff to work on, right?
Yeah.
Um,
Sure.
and that's not just you, that's most people, right? Myself included. And I gave this to Olympians, I've given it to powerlifters. Like there's still stuff that can be worked on, right?
Yeah.
And then this is your workout. 2 workouts a week. Okay. Um, for now, you can use this as part of your strength training. You can use it, basically fit it into your week however you want. I have it on, I
Yeah.
think, Mondays and Fridays on your calendar. Fit it in 2 days a week. I don't care what days
Yeah.
necessarily. Same thing with the other one. I have it 5 days a week, the mobility stuff. Take your, again, your schedule's crazy. So like take those times whenever you need to.
Yeah.
Um, I just obviously you have your schedule and I don't, and it's like you can pick and choose when you have the time to do this stuff. Um, but I have a bridge drill, which is good for calf loading. This is to help the rear foot move a little bit better in and out. This is that RDL, teaching you to hinge. And this is just another calf loading exercise. Okay. Uh,
Excited.
like,
Long time coming, and like I said, I tried a handful of things and definitely never had it be as clear, I guess, as you see the movement analysis. It's like, well, it's pretty obvious.
yeah, which is why I love doing it with people, right?
Yeah,
Just because I don't like saying, yeah, this is what you need to do. And it's like, well, why? You know,
yeah,
it's like, let me show you
yeah,
why. I'd rather show
yeah.
you because I'm a visual learner and I like to teach
I
it.
am too.
Most people are good with visuals. So it's like, this is why.
Yeah,
And then
yeah,
the program reflects like we have 7 exercises total, and it's not even every day, but it's very targeted. It's very specific to that movement pattern that makes sense.
right.
Right.